Hello everyone, my name is Kat, and today on this video I am going to discuss my daughter's lengthy journey with torticollis and all of the providers that we have seen. So I'll describe a little bit about our birth, the chiropractors we've seen, the physical therapists, the neurologists, the orthopedists, the physical rehabilitation, physical medicine doctor, feeding therapist and speech therapist. That's right. We've done it all. We've seen it all. We've seen all of the people. So I'm not going to be really describing exercises or any of that in this video. If you are interested in some of the things that we've learned, please let me know in the feedback. The best place to find me is on my Instagram at Torticollis_tots. That's on Instagram. That's the easiest place. It's easiest for me to respond there. I'm in the beginning stages of building a website where you can find my birth story at length. It's at torticollistot.com. Like I said, it's in the beginning stages. I'm not an IT person, so I'm working on it. Bear with me. But you can go there and hopefully in the future we will have more information for you. So where do I begin? So my baby's name is JoJo, Josephine. We call her JoJo. Today is actually her birthday. She turns 2 today. We just did our third telehealth appointment with a physical therapist this morning. And currently she's down for a nap. So I'm just gonna start from the beginning with torticollis. She has congenital muscular torticollis. When she was first born, I could tell in the first couple of days that she was rotated right. So a little bit about me, I'm a physical therapist. So I have probably a little bit more or a lot more intuition about body structure, awareness, function, form, etc. And I could just tell when she was born, she was a little rotated and tilted. And it appeared to be like a small mass on her neck. But as a new mom, I really didn't think twice about it. But during my pregnancy, I had read a lot about chiropractic care, and I knew that I wanted to go for myself and for my daughter shortly after the birth. We had a little bit of a traumatic birth experience. I was induced, and she had to be kind of forcefully pulled from me during labor because she became hypoxic and she had the cord wrapped around her neck. So there is some theory that potentially she tore her neck when she was being delivered. But the reason I was induced is because I had low amniotic fluid during pregnancy, and we discovered this because my blood pressure began to elevate towards the end of my pregnancy. So that's why I was induced. How they figured it out was I had an anatomy scan where they measure your amniotic fluid in 4 different quadrants, and you should have between 6 and 7 milliliters, and it would discover that I had 0, 0, 0 and less than 1. So there's also this thought that maybe she was just squished when she was in utero the whole time, so that potentially that muscle was shortened when she was inside of me. When I went to the chiropractor, a lot of things that we worked on were like vibration techniques and some stretching. And it was then that we discovered that the mass, I wouldn't say was growing, but as she grew, it became more apparent. So at her 1-month checkup, I brought it up to the doctor, who became alarmed and sent us over instantly to get an ultrasound. During that ultrasound, we discovered that she had what's called a fibromatosis coli, which they attributed to, it's a big fancy name for basically a benign tumor. And so the thought was that during birth, they ripped this part of her neck that caused a bleed, which caused a tumor in the neck. So we ended up seeing a ENT in our area who said, do some physical therapy, it'll resolve on its own, don't get worried about this. So being the healthcare provider I am, I always believe in getting a second opinion. So we had started physical therapy. So we had finished seeing that chiropractor and we'd started physical therapy. And a lot of the stuff we worked on initially was more motor planning and getting her to use her right side, because a lot of kids who have torticollis become to have what they call it neglect. And so she had left-sided or right-sided neglect. So because she was always turned to her left arm and leg developed much faster, and so it almost looked like she had minimal use of her right arm and right leg. So that was a lot of what we focused on, was getting her to reach and use and begin rolling to that side. So we didn't work a lot on her neck during that with that physical therapist. So wanting a second opinion, I went to Cincinnati Children's Hospital, in which I saw an ENT there. And he wanted to get his own ultrasound of her neck. So we did that. And during that ultrasound, he decided he did not think that she had a fibromatosis coli and that this was just pure congenital torticollis. So I will fast forward a little bit and say we've had a third ultrasound that also confirmed this, but also says that that neck muscle is larger than her other side. So this feels like this was forever ago. So I've got like notes over here that I'm taking, but this journey has been so wild and I have seen so many people, y'all. So I was seeing that PT and I kind of felt like we weren't making a lot of progress in regards to her neck musculature. And so I had gotten a referral to go see another physical therapist. So during this time, Joe had started to develop a flat spot. So this would be around 5 months, and it was pretty significant. That was a crazy time trying to get her in to get fitted for a helmet. But where we live, you have to seek a neurologist first. So we saw our neurologist, who kind of checked her out and also decided that her right-sided neglect was due to her torticollis, and that at the time we will assume she hadn't suffered a stroke or had anything bigger going on. Her reflexes were normal and she still appeared to just have the congenital muscular torticollis. But we got the referral for the helmet after I saw 2 different prosthetists to kind of get things moving. And there's definitely something I will have to admit, is that because I am healthcare, I do recognize the fact that if you want something, you kind of have to be your own advocate. And when I say kind of, you have to be your own advocate. So I had tried calling the place in my town for a helmet, and they were delayed like 6-7 weeks. And so I just literally, that company, I called all the surrounding facilities to see if there was an opening sooner. And I was willing to travel 2 to 3 hours to get her in that helmet sooner than later. And I was able to find someone, and we started the initial process, and then was able to get her in the helmet. So because she was in the helmet, she was followed by the neurologist. So I think we saw them for like 3 visits. The bulk of what they did was measure her skull and just kind of have a look at her and gave the referral. I wouldn't say that we learned a lot in those visits with the neurologist. And as far as the helmet, we had to get 2 helmets because Joe's skull was still not completely, her soft spot wasn't completely closed. So we wanted to, when her head got bigger, to go into that second helmet to see if we could get more improvement. Also during this time, after we started with another physical therapist who was super awesome and gave me so many more strategies and treatment techniques to really focus on her neck and strategies to work on her neck and her body at the same time, it was a much better fit for us. So once again, keep looking until you find the right fit and what your gut intuition tells you is the best fit for you. And so then I had started seeing a craniosacral therapist who was doing a lot of full body work, literally from tip to toe to in her mouth and her neck and her skull. We were doing that at the same time while she was in the helmet. And she recommended we go see a speech therapist. And so we traveled to go see a speech therapist which was really enlightening, and we learned a ton in those treatments on how the mouth and the jaw are affected when somebody has torticollis, because as you can imagine, when you're rotated, not only that, but these structures get stressed as well. So we did a lot of speech therapy, and it was really more muscle with her tongue and her mouth, the exercises that we were doing at that time. After that, we saw the physical rehabilitation medicine doctor. Physiatrist is also what they're called. This is a doctor that kind of looks at the body as a whole system. So these are also the doctors in my area. It could be different for your area, but they can prescribe wheelchairs and orthotics and anything that a kid might need in that realm, but they also can provide Botox. And I thought at this time that because Joe's torticollis wasn't resolving as fast as I thought, that Botox might be appropriate for her. So we saw her for 2 visits, and unfortunately that doctor has not been a good fit for us. But in the area that I live, there's only 2. And as of right now, I'm trying different avenues before I reach out to another one, which I think we might go back to Children's, Cincinnati Children's for that. But potentially in your area, there could be a great one who can provide you the resources that you need. What I have discovered in this journey is it is hard to find resources, and you have to be an advocate. And that is partially why I'm doing this video, and also why I'm building a website, because I just want a place for moms and caregivers alike to have kind of one central hub of how to navigate the system. So we had done PT and speech for a while, and then somebody recommended for us to sign up for TEIS, which is Tennessee Early Intervention. And that's basically where somebody comes to the house and evaluates your child, and then we'll decide if you are a candidate to get funding to get your therapy covered. And at that time we were granted yes, which was awesome, because then therapies since then have been paid for. We also had an OT evaluation to make sure that Joe's fine motor skills with her fingers were doing good. And so we only did one evaluation for that, and we decided that she was good to go. I stopped doing speech for a while because that actually wasn't covered by TEIS. This was a private provider, and it was $100 a visit. And although great and super impactful, I felt that we had learned a lot, and we actually might go back to her, but right now we're kind of transitioning between multiple avenues right now. But then I sought out a feeding specialist due to the fact that Joe never had a good latch. She did have a tongue tie, and she now has a lip tie. So with her tongue tie, we had it fixed at her very first pediatrician appointment. So like 4-5 days after she was born, that was fixed in the office at her pediatrician. But I wanted to go see this feeding specialist because it's a new time. First time mom, I really didn't know what the heck I was doing, y'all. And I loved my feeding therapist. She showed me some techniques of using straws and different spoons, and different tools that you could use to help your child better facilitate their mouth, and different foods that you could experiment with to get them to eat. Due to the fact that Joe had a bad latch, I was worried about her oral motor skills when it came to eating. And it is something that you do want to address pretty early on, because left neglected, those issues can turn into speech problems later on. So we saw our feeding therapist, we're seeing the neurologist. Let me see, let's fast forward. So probably about a year in, I have decided that, most torticollis, there's only a rare amount of kids that have it past like 3 months, 4 months, 5 months. And so my daughter now fits that category of the small percentage of kids that still have it. So we have gone to see an orthopedic doctor twice. So this would be the doctor that in the event we're thinking surgery, he would perform that. So we wanted to establish a rapport with him, and I also wanted to get x-rays of her neck to make sure that she didn't have any fusion in her upper cervical spine. So she has had 2 appointments with her orthopedic, and both times she has had x-rays to confirm that she does not have any type of fusion in her upper cervical spine. So Praise Jesus for that, right? Just a little side note, this torticollis has been a really interesting journey for us. I am so grateful that Joe doesn't have anything more serious, and I just always am telling myself that this too shall pass. And I think she was brought to me with this condition to help me help you. So I get a little emotional when I think about it. Regroup. I'll just circle back to the fact that I do have an Instagram, Torticollis_tots on my Instagram, and then I'm kind of just fiddling with the website now, torticollistot.com, but Instagram is where you can see more of our journey together. I'm trying to update it as often as I can. I am a full-time working mama as a physical therapist. My partner, he is a fireman, so he has gone on 24-hour shifts. So it's a little tricky for me to do all the things when I have a 2-year-old whose birthday is today to manage. So getting back to where I was, in the midst of all of this, we discovered that my daughter had a kidney infection, and we have come to find out that she had a malformed ureter at birth. So I could go into a whole other video on that, but we spent right when COVID hit around March, April, and May with Joe having recurrent kidney infections. And June 15th, she had to have a resection surgery, which took her about a month to recover from. So during this time, we did not do any therapies because truthfully, I was just trying to keep my kid alive. As dramatic as that sounds, it was pretty serious, and we thought she was going to lose her kidney. So bless all you mamas out there that are having to deal with something like that on top of this, because I recognize the struggle. But she's healed, she's happy, we've moved on for that. That's another video for another time. But so since this time, I'm kind of refocused, and I just want to get us back on a better path. And so I'm looking up different torticollis clinics in the country that potentially we could visit. I'm looking at children's hospitals that have dealt with children that have more severe cases of torticollis. And I have found a new physical therapist. So this is our 4th physical therapist. And mind you, I'm a physical therapist, but I always like to tell people, yes, I'm so blessed I'm a physical therapist, because I can innately see things in her that I don't think other mamas and daddies might see, but I do have that eye. But I work with adults, and it is different working with children. They have different strategies and techniques that really help me manage a child, especially a toddler, to do physical therapy with. So right now we're working with a physical therapist through telehealth because she's 2 hours away, and she is trained in what's called TMR, which is total motion release. It's a pretty different technique, which I have done in the past, and I have learned so much through the process. So as of right now, I really am all for this physical therapist. So right now we've had 2 really great ones, and I'm so thankful and excited that I have found her. And that was kind of a journey to find her. I was on a Facebook group, and I was able to find her. I was able to find this type of TMR treatment through there, and then I reached out and emailed just a bunch of people on the internet, and I was able to find her. So be an advocate for your kid. This too shall pass. And I hope this was helpful. This has been such a journey for my family, but like I said, I think there's a reason for it, and I hope this helped. If you want, leave some comments. If you have any questions, comments, concerns, reach out to me on Instagram, and have a wonderful day. Bye.